Senior citizens are willing to haul all the way to Canada to save on prescription drugs, and they're doing it together.
Dozens of protesters boarded a train called the RX Express to protest the rising costs.
They want cheaper prescription drugs, and they want them now.
My name is Jerry Flanagan, and we're here to talk about an issue that is affecting every American. That's the high cost of prescription drugs. The point of this trip is not just to go up there and buy 3 months worth of prescriptions. Our goal really is beyond that, is to raise awareness about prescription drugs and healthcare issues in general, and ideally make some major changes that will make sure that the next round of patients who are looking for lower cost prescriptions don't have to head for the Canadian border or the Mexican border to get their prescriptions.
Our guest there should read the legislation. It preempts HMO Bill of Rights laws in 41 states. But what's the value of having insurance that if when you get sick, you have no protections and no guarantees? It's a piece of paper that you pay for, and when you go to the doctor, you don't get the treatment you need. If they want more money to spend in Bacchus's fly fishing trip to Montana, they just raise our premium rates. I mean, these are companies that have unlimited amounts of money to buy access to these events.
Insurance companies broadly look at ways to deny coverage. One of their favorite strategies is to call the treatment experimental, so that they can deny access and keep the premiums and profits for themselves. It's only after you've had a surgery that the insurance company then retroactively cancels your policy.
Outside a state hearing downtown, activists protested against a California institution they say has been corrupted.
The amount of money that Blue Cross has removed from California has exceeded the legal amounts by $6.5 billion. Anthem Blue Cross has been in the news a lot because Anthem Blue Cross is very, very good at gouging people. They're the market leader, not only the largest insurance company, but they're the best at charging people more for less coverage.
Consumer Watchdog says it's called a death spiral. Close a plan to new customers and then raise rates to those who stay so they can't afford it.
Insurance companies across the board will absolutely follow Anthem's lead.
There is no coverage for out-of-network doctors. It is the essential element of a PPO that is being left out of this new coverage.
Consumer Watchdog announced a class action lawsuit against Anthem Blue Cross.
The lawsuit's not about underscoring failures of Obamacare. What this is about is making sure that companies that provide coverage play by the rules, so people purchasing coverage during open enrollment can trust what they're buying.
Consumer Watchdog health policy expert Jerry Flanagan says the Republican plan will actually do the opposite.
By encouraging younger and healthy people to sit out of the market, prices will shoot up for those that decide to buy. And there'll be less federal money available to help you purchase coverage.
Consumer Watchdog has found that when you Google covered California, often the first couple of websites that pop up don't sell state-approved insurance.
By selling this coverage as a PPO insurance plan, the company was committing fraud.
But according to Jerry Flanagan of Consumer Watchdog, it may not be all the consumer's fault.
The fine print is incredibly technical. And you have to believe the insurance companies know that. They know that people aren't going to see that fine print until after the fact. I'm sure it's part of their plan.
Many clients read only the highlights of an insurance policy, assuming even inexpensive health insurance will do the job.
In order to understand the value of the insurance you're buying, you have to know what's also covered.
Jerry Flanagan, the lead attorney for the Consumer Watchdog Group in California, says hundreds of thousands of people lost their doctors when insurers sold narrow networks without notice.
Consumers here were told the networks are going to be the same as they were before Obamacare, as under Obamacare. There's going to be the same network, and your doctor is going to be in it. And those were flat-out lies.
It's absolutely outrageous.
Jerry Flanagan is with Consumer Watchdog, a consumer advocacy group. He says the state needs to regulate testing sites to make sure this doesn't happen.
I want to know who's sticking the stick up my nose before it happens.
Jerry Flanagan with Consumer Watchdog says regulations are needed.
There needs to be oversight. It needs to be local, and it needs to be state. There needs to be credentialing. I am not an IT expert, but I was able to download Zoom, and many doctors' offices now will allow you to do a video conference. So you need little more than an internet connection and a computer, and you can talk to your doctor's office.
That helps to promote social distancing and, in turn, the spread of the virus.
What's putting on display is a problem with a paper-based legal system That was an issue even prior to the pandemic.
California lawmakers and the state's government may need to be more open with its records, documents, and dealings under a new proposed ballot initiative filed Wednesday.
It's that kind of transparency and that kind of accountability that is required. Will legislators hate this? Yes, they will. Is it written in order to create a appropriate balance for public servants? Yes, it is.
Credit bureaus have agreed to wipe any unpaid medical debt less than $500. The majority of medical debt in America is for bills under that threshold. Jerry Flanagan is Consumer Watchdog's litigation director.
This is critical because black marks on your credit report, even for paid medical bills, prevent people from getting loans, renting apartments, buying a car, critical things that we need to do for our lives.
The nonprofit group Consumer Watchdog sued in order to get these files released. Attorney Jerry Flanagan says the public deserves to know what its elected leaders do behind closed doors.
It really is unexplainable when you read these 1,400 pages of documents, how it is that the government prosecutors didn't prosecute Mike Feuer. And how is it, looking at these documents, given all this illegal and unethical activity, that Mike Feuer still has a bar license in California and can practice law? Absolutely unexplainable.
A consumer rights group brought several pot-bellied pigs to a public hearing today to protest what they call the piggy aspects of a proposed HMO merger. Yes. The Foundation for Taxpayer and Consumer Rights is opposing the merger of Pacific Care and United Healthcare HMOs. The spokesperson says that the documents filed on the merger show a plan to reward Pacific Care executives with $230 million in cash and stock.
It's obscene to allow top executives to feed at the trough at a time when millions of Americans and Californians can't afford their health care.
The people involved in the merger accuse the consumer group of trivializing the proceedings by showing up with the pigs.
The pig people from Mountain Bay! What are they doing with the health and wealth of Californians? Who will protect California from the PPOs?
Governor Schwarzenegger has violated his promises to the public by taking big money from special interest groups whose agendas don't align with the needs of the people.